Hello and welcome everybody. Today is August 28th and we're going to be talking about fasting fundamentals today. We're going to be looking at boosting metabolism and a little bit about your health as well and explaining what fasting is. We're just going to take a few moments to let our attendees join on as we've got quite a few onboarding as we go on through. And tonight it will be myself, Samantha Upshall here at Howe Clinics, along with Dr. Jamie Lee from Howe Clinics as well. So hang tight. We've got some good information for you here. I'm just going to stop this share. Wonderful. So typically I would sit out there and I'd put some poll questions out for you guys and ask some questions in regards to our topic. And today I'm actually going to ask you live and see how you can feed back for us a little bit of these answers in our chat down below. And our chat's just here. I don't know if you're going to see my big hello I send out there. So our few questions while we're getting on board. I want you guys to answer in. Do you currently fast? So we're just going to kind of put that basic question there. It's a yes or no. So I'd love to see some folks pop in there. Let us know if you're currently fasting. We're going to talk about that as we get going on further as well. So excellent. We've got a yes in there already. So the question is, I'm going to ask with that, do you fast? Excellent. We've got some more yays and yeses in there. What is it that you specifically fast for? And I'm wondering if you guys are able to kind of put in there of why you thought about fasting and why you've initiated as well. So those few folks that have put in the yeses in there, what do you fast for? So that will just take a few moments as we kind of get that going. And while you're answering those, today, I'm going to talk a little bit at the beginning. Dr. Lee will be popping in, and then afterwards, he's going to be covering a little bit more on the overall aspect of fasting and health benefits as well. But today's top topic that I'm going to kind of start with is, why has fasting become that hot topic? Why are you guys doing it? I've got those answers coming in there. So we're going to work over those, and I've got one more question. So that was, what do you fast for? Here's an easier one for you guys to put in there as well. So if you're thinking about what is it for, I want to see, what was the longest you have actually fasted? So how long have you stretched that fast before? Are we thinking 8 hours, 12 hours of no eating, 16 hours? Has anyone done 24-hour fast out there, or even longer as that goes? So please keep popping those questions as we go. We've got a few answers that are popping in there. 36 hours starting fasted after a previous Howe webinar. So, our webinars are getting out there, Dr. Lee. We've talked about fasting in, it could have been in muscle mass, could have been around the carbohydrates, but it does come up as a wonderful health benefit. So it's lovely to know that, you've heard some information from us and you gave it a whirl. One of our patients that we know as well in here is put 24 eating once a day. Another patient has put in there usually 18 hours, 6 till noon the next day. Longest has been 24 hours. So congratulations on that, because that's a lot of mental resiliency that we have to get through, along with the physical aspects of it. So it's nice to know that our attendees today have given it a whirl. Some may not have, because we haven't got all responses in there. So yes, fasting is the new hot topic, and that's why I need to bring it up. It's all sorts of things come through on social media and kind of go and ebb and flow as it goes. But I have noticed myself a lot more questions on fasting, and it's been out there. So I thought, why not? Let's bring out our perspective as well. So the question that I had out there, why has fasting become a hot topic in wellness and health itself? Now, there's many reasons as we go, and I'll give a few details as we keep on going. But there's a lot of, number one, the most important one is that we always want to look at, there's a lot of scientific backing up of this as we go. It's not something new that's been around there. There's plenty of science and studies on all different perspectives of when it comes down to fasting. And we're going to talk more about that. And I don't want to take away Dr. Lee's talk as we get going, and that will be part of his information as well. But the popularity intermittent fasting is something, when we think about trying to, we're going to specifically talk about weight management as well. It may be an easier focus for some of our patients to pick up, as unlike traditional diets that focusing on what to eat, the intermittent fasting actually is focusing on when to eat. So it's really looking at that caloric reduction of are we actually bypassing, a 500 caloric meal intake that we don't have as we get going. And a lot of folks find it much easier, instead of worrying about food, is just kind of transitioning into the time of when they should eat. Definitely plenty of celebrity endorsements and media coverage out there, as I mentioned. One of the physicians that we'll talk about here eventually will be around some book suggestions that we could have for learning. But, I'm seeing, Jason Fung, if anyone knows who Jason Fung is, there's a wonderful book out there of his in regards to fasting. It's the Complete Guide to Fasting itself. Really good resources. And towards the end, I'll give you some more information there. But number 4 is something that some of our patients will come in and talk about too. I don't want to take anti-obesity medications. I don't want to, change that flow of what I'm going. Is there any natural elements? And, this is a way to help heal and reset yourself without taking anything, literally, where we're fasting as we get going. So it may be, an alternate solution for individuals that they're able to kind of reset or reconfigure the way that their metabolism is running there as well. There's a great element of the popularity there, the potential decrease of health perspectives here as well. Now, what I'm going to do, just if I can take a second, is I do have a screen to share to kind of show you just briefly. And once again, Dr. Lee will be having a look at these as well as we go. Actually, I'll be pulling it up afterwards when he does his talk, but we've got anywhere from the cognitive health. So starting from the head down, we've got cognitive health there that it can help with and reduce inflammation as well. We've got increased insulin sensitivity, increased insulin. I already mentioned that one there, lowering blood pressure, as well as being very known for helps with fatty liver as we get going. And the lipolysis, the burning of fat is very beneficial as well. This next portion is number 7. When we think about fasting, it happens, yes, we talk about it in weight management, but we see it in a lot of religious and cultural aspects as we go on through as well for different purposes. And some of that historical background is quite amusing as you go. And I'm just going to see if I can actually get that slide is what I want to do here. So just hang with me. I'm going to actually go through some screens for a second here and see what I can pull up. Guess what? Seems to be one of those days on my end too. And I'm just going to roll with the punches. I'm just going to respond with this. Sorry, Dr. Lee, I can't pull up that image right now while I'm sitting here live as we get going. But, when we start looking back into ancient times, there was a lot of fasting happening back there as well. They're believing in that purification element of fasting, that it could please the gods and bring favor. And, I know when I'm fasting, I'm pleasing this God here. My body is that temple as I'm going. But ancient Egyptians, this is how far this fasting element goes back to. So it's not just the new the craze that we're talking about right now, but they're using it once again in that field to kind of purify their body and soul for a religious purpose, to get it closer to that divine communication. But the Greeks, do you remember that guy's name? You said it better, Dr. Lee.
Pythagorean.
Agreed, yes.
Yeah, he developed the Pythagorean theorem, x squared equals y squared plus a squared. Yeah.
So he was a mathematician itself and practiced spiritual and philosophical practices. And his perspective of fasting there was to clear the mind and prepare the body for spiritual alignment. But what really caught me was the clearing of the mind. I'm not sure if you guys out there that have answered yes to this fasting, if you guys have ever actually experienced a different sensation with the body or the clearing of the mind. Yeah, Dr. Lee, you got it. Yeah. I it's funny. I'm more, I don't know, I do get a little bit of giddiness in there as well as I go
Mhm.
along, but much clearer. I don't feel like I am right now in this midst of trying to find that folder that I want to, or that image that I wanted to show with you guys. But it goes back well beyond time itself. So it's not a new creation, but we've now got more studies and medical effects that we can actually apply to this for the evidence base there. Now, there's obviously, when we think about religion, there's multiple religions out there that practice fasting. And these fastings are extended fasts. We're not looking at just doing typically a 12-hour fast. It could be from, sun up to sun down as we go, but some are over 24 hours or up to 72 hours as they go. But we have Christianity, we're kind of thinking about around Lent itself. We're looking at the Islamic Arabic element, the Islam religion itself. They're doing plenty of fasting.
Ramadan, yeah.
Judaism, right? Just
Yep.
recently, there was a fast that I had was educated on as well. That was 1-day fast itself, and it's a lot of that. The Judaism elements actually fall into the Christianity side of things as well. Hinduism, we've got Buddhism, Jainism as well. Now, I haven't got this one written down because it really wasn't part within it, but there's the Tao elements in there as well, but multiple, whether it come from a religious, but it comes down to that mind element, that connection with body and mind as we go on through. So there's a little bit of a historical, just a brief historical background as we go, just knowing that, it's not a new philosophy that we're working on, and it's been around for many years as we go. I don't know if you had anything to add into that section there, Dr. Lee, before I actually start talking about what is fasting.
Yeah, absolutely. I think what you said was right. And I think, definitely people need to understand that fasting is not a fad. It's been around for ages, thousands and thousands of years. You got to distinguish between fasting and starvation, right? So, starvation is involuntary, fasting is voluntary. And I think, the spiritual, the mind part, there's some mental clarity to that. And if anybody's fasted more than 24 hours, and you've done it, you've had some shorter fasting before, what you'll find is that, your body feels lighter in general. And I think when you hear about the spiritual aspect, the cleansing part of the body, we have science to prove that and what's going on in the body, whereas back in the day they relied on the feedback of the body, right, which is totally different. So if you've fasted more than 24 hours, there is a lightness that you feel to yourself. And I think what you said, same with all those individuals and all those religions are doing that. It was just a positive feedback that they did. They felt well, and so they probably continue to do that. If it wasn't well, they probably would not continue that. It would be, we would outgrow that kind of behavior, right? So I think that's why it's kind of lasted thousands of years. That's probably the best eating style, right? That's lasted all these years. Really, it's a style it's a lifestyle, fasting lifestyle, right? So it really has tested the times. Yeah.
And it's a process that most individuals can do. There's definitely appropriateness, which we can talk about it as we get going as well. Now, as Dr. Lee had said there, that fasting is a practice, a voluntary absence of food. So it's the voluntary aspect, withholding food or drinks as that goes along. Now, there's many different approaches to fasting out there, and this is another question for the community. Because I do have questions that come in, how should I fast itself? I've learned about 12-12. I've learned about 16-8. My question is to you guys, if you actually have used that terminology or found that terminology itself, what do you think you're doing? When I mean 12 and 12, what I'm speaking about is that 12 hours of voluntary absence of food, and then you have a 12-hour open window of consuming food itself. So I know that I heard from one individual in there, they kind of put down an 18. So they had 6 from 6 till noon the next day. So that's an 18 split. And then that would be, I got the 2, 18 and 6 as that goes along. But there's multiple methods. So 12 and 12, I mentioned 12 hours of fasting, 12 hours of eating. Most individuals may look at it around the 7 a.m. start, eating breakfast at 7 a.m. and finishing at 7 p.m. at night. I do find that a lot of our patients will have much more ease with adjusting their morning fast, bringing their fast going into the morning hours versus cutting back their nighttime eating, because that's where we're left with a lot of cognitive thoughts or changes in the evening. We have different cues and points that they do find that easier. And I love sleeping through my fast. Well, let's get a free 8 hours of not worrying about food as it goes. And typically that's where the day becomes busy and you're not thinking about food as much. There's a more moderate approach when we think about that, because that's only 12 hours of absence. Now, each section of how long you fast has its own benefits as we get going. So as we add a few more hours, we're actually seeing more happening internally with the body. Now, a 14-10 split, more moderate. 16-8 method is one of the most popular methods, and that's more of a intermittent fast, a longer intermittent fast. So you still have a small window of eating. Now, that is more of an intermittent. There's some time restricted eating as well, which is very similar to intermittent. It just means
there's no difference. It's just one's the opposite of the other, right? So
yeah,
people use it interchangeably. So to me, it's not a big difference.
Yeah, I put them right in the same words there. So the 5-2 diet normally has you eat, and this more fell for me under that time restricted eating, is that you eat normally for 5 days of the week, and then you restrict your caloric intake for 2 days itself. So that could be a fasting period for those 2 days, or it could be a restriction of around 500 to 600 calories on those 2 days. Now, these aren't recommendations that I'm handing out to, the broad individuals. It's very important that you do talk to your health professional to make sure that your body is prepared for this, that medically you are not causing any other complications. These are just things that I want to educate of what type of fast are out there. There's a stop, eat, stop. Eat, stop, eat. Sorry. I like to eat, so I want to put the sandwich or stop in the middle. It involves fasting for 24 hours, once or twice that week itself. So that is something that, I have a tendency to do, more that 14 hours of without food most days, just because I'm not hungry till that's placed. I wait until I'm physically cued. But I do find that, a Monday that I might practice that eat, stop, eat, and have a very different consumption on those days. And it's really just protective for me, because there may be tendencies on a weekend, or like all of us out there, we have different periods of our life that we eat differently as well. Now, there's a prolonged fasting as well. All right. This is where you really should speak with a medical professional, because we're actually talking extending our fast beyond 24 hours, up to 48 hours or beyond. This is to be done less frequent than our 12-hour fast, our 14-hour fasts. But there is plenty of cautions that we have to make, just to make sure that underlying conditions are safe.
Yeah, I just want to touch base with respect to the safety aspect of fasting, and who can fast and stuff like that. Like anything we say, these are just obviously suggestions, not medical advice, right? We really can't give medical advice over the webinar, so that's why we have actually a full-on clinic that does this, where we can monitor you. Even with weight loss, as you're going through weight loss, things can change. There's thousands of biochemical processes that goes on through your body, right? And when you start to lose weight, the body has to adjust and adapt. And so people think, oh, I'm just going to lose weight, and everything's going to be okay. Sometimes it's not. You lose electrolytes, you're not drinking enough, you get dehydration, you get constipations and all that kind of stuff, right? And so just with weight loss that you're attempting to do, and imagine that you're restricting food, and Sam was talking about, the dry fasting, where you don't drink water, and that tends to be more religious aspect than from a health aspect. And so it's very important to understand why you're doing it, whether this is religion versus for health. Obviously, from a health clinic, we're doing it for health and longevity, right? Which I'll get into a little later on, how it can help with longevity and stuff like that. But from a safety aspect, one of the key things, if you have any form of medical condition, you should talk to your healthcare advisor, practitioner, to make sure everything is okay to fast. And don't just go dive deep into fasting. I'm going to do 24 hours, 12 hours. You're not going to survive and you're going to get discouraged, right? It is a lot mind over matter if you haven't ever fasted before and where you started off. And it will kind of determine how far you can go to as well, right? But any form of medical conditions, you're on any medications as well, it can affect your overall health, right? So that's very important. Even if you're healthy as an individual, we may have underlying conditions that we do not know about, right? And so it is good to have just a checkup with the family doctor to do, the bare minimum of blood works to make sure everything is good too as well. So that's with any kind of health changes you make in your lives, that you should at least talk with a healthcare practitioner.
Yeah, I actually recall a few weeks back when it was a Monday, I was fasting. I think I'd mentioned into you the afternoon that I'm just like, I don't feel great. And I think your comment that you made to me, and I thought I was doing well until I actually, went in and recalculated, was, did you drink enough water today? And I hadn't drank enough water that day. And it was quite a big difference of keeping that body hydrated. And nutrition going on through it as you go, but it makes a big difference, with or without fluids as it goes. But I don't recommend doing a complete dry fast, and yeah, unless you're speaking to somebody, because it can feel a little off. And these electrolytes themselves, they're very essential for our cardiac health, for our muscle, for everything as we go on by. So that's, I've very kept this information quite basic to begin with, because Dr. Lee is going to bring that in very shortly as it goes. Now, Dr. Lee and I were talking prior, and just kind of going over the webinar as we go. And something that I wanted, because we're just kind of talking about the basic form of it right now, is, I was more concentrating on how to break a fast, but you had brought my attention, and let's actually talk about how to initiate a fast itself, which is, not easy to just kind of jump in and all of a sudden pull out 16 hours of fasting. It can be done, but it can be very difficult just depending on, what does your current consumption look like? And do you mind kind of doing a little chat there of what we were talking about prior there, Dr. Lee?
100%. So if you want to start fasting, and you've never fasted before, it's always good to ease into things. Obviously, that's just common sense, right? But there's a few things that happen when you start fasting. This has to tie into a bit of physiology. So I'm gonna have to talk about a bit of physiology and metabolism to go along, so you guys understand what's happening to your body. There was a cool study done by Calhill, I think in the 70s. He's a physician, researcher, I believe, and it was in Massachusetts, I believe, one of those Ivy League schools, medical schools. And the best way to learn what happens in your body is just to starve someone and monitor them, monitor blood work, monitor the weight, and see what they do. And so basically what they did was they put people on a water fast. They gave them IV saline, make sure the electrolytes are good, and kind of watch them what they do, right? And so what happens, obviously, they start to lose weight, to lose a lot of water weight, to lose a lot of muscle mass. So what happens as you start to fast, what happens is you start to have a metabolic change with respect to your body, right? And so predominantly our body likes glucose as the source of fuel, and glucose predominantly comes from carbohydrate. That's why the majority of us have a higher carbohydrate caloric intake. And so if you eat a lot, and you eat a lot of refined carbohydrates, as opposed to more complex carbohydrates, what happens is you can have a lot of high sugar spikes, and your sugar levels in your blood tends to be a little higher in general. And so you're living at that kind of sugar level. So when you start fasting, the blood sugar tends to drop a little bit, obviously, because you're not having the input of the sugar into your system. And, obviously the insulin still works and stuff like that. And so your sugar starts to drop a little bit. And in a normal day-to-day, what you might find is that after several hours of eating, you might be looking for food. you might be feeling a little hungry. But if you prolong that for a few more hours, let's say 2 3 hours, you might go 4 5 6 hours. What happens sometimes, people feel a little weak and tired or shaky or a little nauseous, a little anxious too as well. And that's because what happens is that your body is used to a certain level of glucose. It could still be in within normal range of the glucose, but you're higher, right? So the range is usually from 3.4 to like 6.5, 6.8. That's kind of the normal range. That's a little too high, actually. 6.2. And then, so you might be in a 6 or 5.8, whereas someone else could be in about a 5. And so if you stop eating food, what happens is your sugar might drop by 0.5 millimoles or 1 millimole, and that can trigger your response to want food, right? And so people get shaky. So, case in point is my wife. My wife is notorious in the past for this. And she would eat every 34 hours, just because she feels shaky. And so I challenged her one day, when that happens, just check your sugar, right? Check your sugar, see what it is, see if it's in the normal range. And it is in a normal range, but just a little higher. And so over time, what I did is I just coached her just to start to decrease the amount of food she's eating and start to lengthen the time slowly instead of doing a longer fasting. So that's what happens as you start to fast, right? Your sugar starts to lower a little bit and you start to do that. So what's important is that whether you fast in the past, if you've never fasted, you likely have a lot of glycogen storage in your body, right? And so the body will start to pump up the glucose as you're starting to fast. And that's kind of the first thing that happens. And so if you have fasted for a long time, or you have a very lower calorie consumption, there's less glycogen storage, right? And so the body can adapt a little easier. You might have gone a little longer with eating. And so other mechanisms of glucose production will kick in. And so the way the body works is that the carbohydrates are the first, followed by lipids, and followed by protein. So what they saw in the Cal Hill study back in the 70s is that your protein mass starts to drop down fairly quickly, and at about 4 to 6 weeks, it starts to plateau. The rate of protein usage and protein production tends to be equal, right? And that's after 4 to 6 of no eating. That's just pure water diet. So that's the best way, the way we start. And what happens is that then they see is the carbohydrate production for glucose starts to decrease as the glycogen storage decreases. And that actually depletes in about a few days, and less than a week or so, for sure less than 2 weeks. And the lipolysis that Sam was talking about, the ketone production, using fatty lipids as a source of energy, starts to rise. And you see this crossover point. And that crossover point is between 1 and 2 weeks, or a little earlier, depending on the individual too as well. And so for those that fast about 6 to 8 hours, and like Sam said, when you're starting to fast overnight time, is a good way to start to learn how to fast, is that after 6 to 8 hours, 6 hours of eating, the food is pretty much 6 to 8 hours, pretty much gone out of your entire system, your entire GI tract. It's been processed, it's gone through the stomach, it's gone through the small intestine, and all the byproduct goes into the colon area. And what happens is that you're starting to use fatty acids as a source of glucose. So these energy kind of sources production doesn't happen in silo, but there's a predominance, right? So your smooth muscle cells in your body starts to use a little bit of fat breakdown, right? That's why after 6 to 8 hours, you don't feel as bloated and all that kind of stuff in the stomach and your food, because pretty much all the food in your gut, your GI tract, has left the body too as well. And so really, whether the type of food that you eat, if you eat really high refined carbohydrates, you'll tend to feel more hungry. Yeah, it might tend to have a little bit more side effects from a lower kind of glucose, and the amount of food that you eat too as well. So those things do play a role with respect to the initial parts of fasting.
And we're talking about some of the first times that you're initiating fasting itself, as you get going. And some of the nutrition, as Dr. Lee is saying, is looking at some of the lower glycemic foods. If you've been in the clinic recently, I've, been helping a lot more individuals with these lower lists to kind of hand out there to help you guys. And it's looking at different resources of food intake as it goes. And you've probably seen, over our previous webinars showing the difference of different carbohydrates of how they spike that glucose. And, I do actually, I'm going to try one more thing here for you guys, and I'm going to share a little
Obviously,
document.
one of the most important conditions when it comes to fasting is diabetes. And so if you have
Mhm.
diabetes, and obviously you should definitely talk to your family doctor or any practitioner you're working with respect to that. It's not that it can't be done. It definitely can be done. It's just the
Mhm.
monitoring part. And as Sam said, Jason Fung, he wrote a book called The Diabetes Code, and how he uses fasting to help people reduce insulin resistance. And the earlier you can reduce insulin resistance, the better, the more likelihood that you'll have the ability to reverse diabetes as well. So diabetes, type 2 diabetes definitely is reversible. And one of the important things that you have to understand, that even type 1 diabetics can become type 2 diabetics as well. Just, the insulin is just exogenous, meaning we inject it versus made inside our body. And so you can, if you know a type 1 diabetic, over the years, what happens is that they need more and more insulin. So that means they're becoming more insulin resistant, right? So that's just the other thing about it too as well.
Now, I've got a document I'm just sharing here right now. This is actually from Jason Fung's book here that I'm showing you some of the diagrams that you could see in this book. But you brought up the word insulin resistance itself there, but this is around the insulin release itself. So we kind of see in this bottom factor when we're having these foods all day long versus the sensitivity of our insulin when we're not. Makes a big difference within there as we kind of travel on through. I found a share button. I wanted to share and get that out there. But really, really great resources. And this book here, as you go on through, you will also find,
Yeah.
a lot of scientific backing
Just
for
can you
it.
pop back that thing that last the
Oh,
graphics?
you
I just
really
want to
hope I can
mention
do that.
something, because
Okay, there we
there's
go.
some practitioners that recommend eating 7 to 8 times a day. And I think that's totally fine. I think it's just where you're at. A lot of patients just want to lose weight, they're not diabetic, and that's totally fine. But I think if you're a diabetic, you definitely have to have periods of no food to allow the body to heal itself. Okay, the body to use its own fat as a fuel source. That's very, very important. As you can see there, the upper where the arrow is there, you see you get a low insulin point. That's what you want, right? Versus the bottom where there's always some insulin level in our system too as well, right? And so I just want to make that distinction between, some practitioners would recommend eating smaller meals, which is totally great because your overall peak of insulin is lower versus you have like one large meal too as well, right? So there's a trade-off on what to do, and there's no like guidelines for this. It's just what's working for you, and you have to monitor your weight loss, monitor your blood sugars as well. And so that's a very important point, the peaks of insulin spike, because that correlates with the glucose spike. You see the dinner, we tend to have a larger meal. What happens? And we have a bigger insulin spike, right? And so that's what happens. So imagine if you had a moderate amount of food, then you have obviously a lower amount of insulin spike. And so overall, you can improve your glycemic index, your hemoglobin A1C, etc., all those things.
That's beautiful. Yes, and trying to pick the right fast for you is about what's right for you
Yeah.
as you go on and fill things out, because I've heard patient experiences that they really wanted to do 16 hours, but they got to the
Yeah.
16 hours and they couldn't stop eating.
Yeah.
And it's just trying to, I work on them, just trying to adjust to find that sweet spot. But it is looking at the day before, you're waking up really hungry. What is causing that hunger today? Because it's different. It doesn't happen every single morning now. Is reflecting back at some of those intakes itself, whether it was higher glycemic foods or lower, whatever it may be. But it's typically a higher carbohydrate and different dinner that we've had. Now, carbs aren't bad, but it's, it could have been the McDonald's that night versus, the bean medley as we go on through and look at it. But I want you guys to really feel that out. When you are eating out of more of that fun list, because you've chosen that and you've prepared for it, is listen to the hunger that happens after it. See how it actually cues you on. There's more to it than just the carbohydrate sense of it all. You know, a lot of things are happening up in the pleasure center, and it's very hard to, you know, move beyond that as it goes. But you'll notice different things that you eat will prompt on different hungers as you go on through, and looking at that. So, you know, that's a little bit about fasting, how to start a fast, what it looks like. What's right for you is let's just kind of start, you know, bringing in different hours to that day, trying it in different phases. Some, as I said, I'm an overnighter. I like kind of starting at nighttime, bringing it in and breaking it in the morning. Some folks will do it during the day and eat at night. It's really just depending on who you are and what you need. And, you know, even for myself, if I'm hungry, I'll reflect if it's earlier. You know, if I'm used to doing 16 hours and I'm at the 14 or 12-hour mark, consider of where the possibilities of hunger are coming from. But if it's true hungry, I'm at a position that I eat now, but it's making sure what I eat. You know, and breaking those fasts can be just as important of how we start the fast, because they're going to do the same thing. You know, if you're breaking your fast and you know, we're heading out to fast food, processed foods, you're going to want to keep on eating. You'll have that satiety, that fullness, because it's, you know, we'll have fats in it, probably have some protein, but a lot of carbs, a lot of greasiness. You'll have that satisfaction point for probably about a half an hour to an hour, and then you may crave or want more as that goes along. So it's, you know, trying to always include proteins and healthy fats when you're breaking that fast, as a highlight, and some of, you know, your healthy carbohydrates as a balanced plate. Let's just kind of talk a balanced homemade plate. Farm to table would be very beneficial as you get going. But yeah, if we're breaking into a bagel and cream cheese, it'll give us a different thing than if we're, you know, waking up and having whole grain toast, some avocado, and some eggs. You know, even if it was less food, you would still get a lot better success out of that. So, you know, I've talked to my patients about that. We've kind of planned different meals as it goes, and they find that when they're having the protein and the fats, they can actually extend that a little bit further for that next meal, even though that they're hungry and haven't eaten all day. So, really dependent on the individual. You know, if you're ever needing help, come in and talk to us about that as you go. So, I want to jump into, here's the fun part. You know, we can find the fasting 12-16 split. You guys probably have already investigated. I want to get Dr. Lee in talking about the science behind it. Really get us convinced within there about, you know, how fasting you know, helps metabolism. We're going to look at cellular cleanup. We're going to look at some hormonal responses, cardiovascular health, all the good things there. So, Dr. Lee, you go ahead, and I'll pop in and kind of give my tidbits too as need be.
Yeah. So obviously when we're fasting, you know, the fuel source for our body is glucose, and you know, and the body will try to make glucose in multiple ways, you know, from carbohydrates, from converting fatty lipids to our lipids to fatty acids, which converge to glucose, and then also protein. Obviously, the protein is the last thing, but all these things don't work in silo. And so when you start to fast, the body will start to pump up more glucose because there's no glucose going in. So it's going to involve all those three processes. But in our body, what happens is that we store a large amount of glycogen. And so one of the largest organ with glycogen is our liver. You know, and there's other areas of the glycogen as well, which is basically in our muscle. Those are the two organs that also the muscle has the most amount of glycogen. And your liver has about maybe depending on the size of the 600, 700, 800 grams of glycogen storage. So if you can do the math in terms of calories, how it can last you. And so when you start fasting, the body will start to deplete its glycogen. It needs glucose. It's going to start decreasing its glycogen store. Your insulin's always working, by the way, because your insulin is trying to maintain a blood sugar level, right? It's between these two hormones of glucagon, which increases glucose in our body, and insulin. When you have too much sugar, the insulin will go up and it will bring it down. When you have a hypoglycemic state, so people overshoot the insulin, or type 1 diabetics who don't have it, they will generate more glucagon, which increases sugar. In the hospital, when people have super low sugars, we give them glucagon, right, to bring up the sugars, along with you know, something that's rich in carbohydrates, like a juice or something like that. So really, it's the interplay between these things. And so the benefits of fasting comes when you start to change your metabolism towards using more fat, right? And so anybody's I've heard of fatty liver disease, that's one of the very first signs of insulin resistance. If someone says to you, or you've been diagnosed with fatty liver disease, you probably 99 or 100% will have some degree of insulin resistance. And so what happens then over time, and this is what, what Dr. Fung's premise, why we're using fasting as a source. So as you start to fast on a regular basis, let's say, 12 hours or one full day, once a week or twice a week or whatever. And Jason Fung, I think he fasts 24 hours once a day. That's his kind of regimen that he's been doing. At least from his books anyways, is that over time you start to deplete your glycogen store. And so what happens is you tap into your fatty lipid stores, your fat stores. That's where we want to get rid of. But the beauty of it is that when we start to use our fat as an energy source, it's not the fat that you or I can pinch that we use. It's the fat around the organs, and that's what matters, right? And so if you ever look at I think when we did the lipid talk, I showed a slide of a microscopic slide, a pathologic slide of the liver. You see these vacuoles of fat that get deposited in the liver cells, and that impedes its function over time, right? And causes inflammation. So as you start to shrink that, right? And remember, fat cells don't die, they just shrink. Okay, so remember that. And so it's a unique property of fat cells. And so they shrink. And then as they shrink, your organ function starts to work better and better. And so you become less insulin resistant, right? And so you have the ability to drive glucose into your organs much faster, easier, into your cells, sorry, and all that kind of stuff improves your overall health, right? So that's what kind of the interplay between your interplay of insulin and glucagon to balance your sugar out over time. There's a few other things that happen when you start fasting as well. It produces it elicits some human growth hormone, and human growth hormone is that muscle building hormone. Teenager youths, they have a lot of lean muscle mass, and that's because they have a lot of human growth hormone, right? As we start to get older, after the age of 30, your human growth hormone starts to decline. But if you start to fast, you can actually stimulate that human growth hormone too as well. And human growth helps with decreasing insulin resistance over time as well. And so as you start to improve your insulin resistance, right, your sugar level starts to decrease over time, your hemoglobin starts to improve, and all that, and we know like a lot of physicians want to keep your sugars into a certain way and certain range to reduce cardiovascular disease and stuff like that. Obviously there's a lot of inflammation that goes on with a poor eating style, and fasting actually starts to reduce the inflammation that goes on. One is the food that we eat is, if you have high sugars and stuff like that, and have a significant weight, likely tends to be more inflammatory, more processed, more refined, more packaged, a lot of preservatives. All these things contribute to the inflammation over time. Now, so what happens when you start to use your lipids, right? Your cholesterol panel starts to change over time, right? You're low in triglycerides, you're not eating food, and so when you don't eat, you consume less protein, meat, right? And saturated fat comes predominantly from meat products. And your cholesterol starts to change over time too as well. So your LDL goes down, and actually HDL may go up over time with a bit of fasting too as well, but it can go up or down, and so it doesn't really matter too much. But for sure, if you fast, your LDL starts to go down. Similarly in the past, and we talked about when we look at someone's lipid profile, I can tell who eats a high carbohydrate, high fat food, because typically when you eat a high carbohydrate, high fat food, your triglycerides are up and your LDLs tend to be up, right? And so when we do a ketogenic diet, what happens? Well, your cholesterol levels kind of can fluctuate up or down, but your triglyceride plummets, right? And so that's just part of how the body responds to the lipids over time. So that affects your cardiovascular system, because all the cardiologist wants us to lower LDL, which has an association with coronary disease. In addition to that, inflammation is thought to be the prevailing theory at this point to start the cascade of coronary disease. And, if you think about fats in general, let's say you oils and fats in general. So at room temperature, it's a solid, let's say butter, right? It's a solid in room temperature. But it doesn't take much to melt it. So in our body, the temperature is about 35, 36, 36, 37 degrees, right? And so at that time, the butter would probably be melted, right? The fat would be melted, right? So it doesn't really clog our arteries that the way they depict it. It's usually, it starts with breaking of what we call the endothelial system, the endothelial lining, which is the lining of the innermost part of the vessels. And what happens is you have inflammation, you get damage to the vessel. There's a cascade of inflammation. That's what happens. The platelets attached to it, and then becomes very sticky, and your lipid starts to attach to it, and it causes inflammatory cytokines. And that kind of what builds your coronary disease. So when you start fasting, all those kind of things start to decrease. That's why you start to, that's one mechanism of improving your cardiovascular health over time. Now, there's a lot of talk about longevity with fasting, and the reason for that is there are lots of studies for that nowadays. And so when fasting became really popular, like 15 years ago and 10 years ago and stuff like that, there's been a lot of studies. I think the last maybe 5 years been extremely popular to see in TED Talks and all those type of things. And so there was a scientist from Japan who won the Nobel Laureate for this discovery. And what he discovered was something called autophagy. Autophagy, auto self phagocytosis, which is the phagy part comes from, to mean phagocytosis is self-engulfing or eating. And so if you think about autophagy, self-eating, what he discovered was that there's a process in our body called autophagy. And the best way to think autophagy is our cleanup system in our body, right? And so, as I mentioned earlier, we have thousands and thousands of chemical reactions. If you're constantly eating, the body has to constantly work to process the food. It has no time, it's like a traffic road. During the day, the cars are like constant. The cleaning crew that sweeps the roads ain't gonna come because it's gonna slow the traffic down, because of traffic jam. And so if you're constantly eating, it has no time to clean up all the garbage that's lying on the streets and whatnot, sweep it up, the sweeper, right? So autophagy basically is those guys that come and clean up, and it's everywhere in your body, the central nervous system, the GI tract, and everything too as well. So what he discovered was that our body has this cleanup system, and a lot of conditions that we have impairment in this autophagy problem, right? Is it a lifestyle thing? Is it a genetic thing? Yes, there is definitely a genetic. There are conditions that affect autophagy, but a lot of it is that our lifestyle affects this too as well, right? And so, a lot of the central nervous systems, disorders are felt related to a lot of what we call plaques, which is debris of processing of proteins and stuff like that gets in our system. And so when we have a lack of that, basically your body is filled with materials, things that technically should not be there. The body should get rid of it. And as you start to build this up, you might get more inflammation, more joint pain, more aches and pains. You're not recovering as fast. There's association with autophagy to central nervous disorders such as, Alzheimer's, Parkinson's disease. And so it has been linked to a lot of things. And this is why the discovery of autophagy was really important. That's why this Japanese scientist won the Nobel Laureate for this in medicine. So how does that play into fasting? When you fast, you give the body a chance to heal, right? There's something called circadian rhythm. We all know that, right? I'm a sleep guy. We talk about circadian rhythm too as well. As a human, one system, we're made up of billions and trillions of trillions of cells. So we have our own circadian. So, you know, I go sleep at around 9:30, I get up around 5:15, 5 o'clock. That's my circadian rhythm, right? Each individual cell in your organs have their own circadian rhythm. And they actually were able to discover a protein that decodes that circadian rhythm. Your gut system, your renal system, your heart system, your lung, they all have their own circadian, particularly your gut, right? So your gut needs a time to rest. If you don't give time to the GI system to rest, it means, you know, avoiding food for an extended period of time, the body can't heal itself. So if you're eating at 10, 11 o'clock at nighttime when the circadian rhythm is supposed to be down, it's resting, you're going to cause more harm down the road over time. That's why we have a lot of reflux disease, you know, gastrointestinal bleeds, dysphagia, you know, dyspepsia, cramping, all these type of things that go along with it too as well. And so fasting allows the body to heal through autophagy, through its own circadian rhythm, allows the body to reproduce its newer cells. So, for example, we overturn the cell linings of the GI tract like every few days. I can't remember the exact, but it's like very short. But if you're constantly eating every 4 or 5 hours, the body really doesn't have that time to produce new cells. It's just working on the digestive system as well, right? And so that's how it's been linked up. So the other thing that they've discovered is that, you know, there's a bit of a longevity with it, right? With fasting as well. So at the ends of a chromosome, there's something called telomerase, and sort of telomeres. And as we start to age, these telomeres starts to shorten over time. And what they've seen is that people who fast longer have less activity of this what called telomerase, which is the enzyme that starts to kind of unravel our ends of the protein. So if you have a higher telomerase activity, you tend to age a little faster. And there are actually genetic conditions, just eludes my mind at this point, that starts to deteriorate that over time. So fasting actually slows that activity and allows us to actually keep our genetic material, and that's actually correlated with longevity and aging too as well. And I don't know if you ever fasted for more than 24 hours, especially if you've done a lower carbohydrate food and or you've done a ketogenic diet, you know, it's very similar, right? When you fast, you can produce ketones. Like I said, you know, just similar to when you start to break down fat for energy. So the ketogenic diet, you know, you're eating very, very low carbohydrate, usually less than 50 milligrams and of carbohydrates, and you're eating higher protein. So what happens is you actually produce more ketones. In essence, that kind of is similar to fasting, but not the same. Okay, you're still consuming food. It's that feeling that Sam was talking about, that pep in your walk, the mental clarity. There is a certain point that you'll start to achieve that, right? That granted, if you do it properly, like, you know, make sure you're not dehydrated, etc., all that kind of stuff. But there is a certain time of fasting becomes more beneficial, though. So the longer you fast, the more beneficial it is. But there is also an upper echelon of how much you should fast to as well, right? Because obviously, you know, the body needs nutrients, the body needs electrolytes, all these things. And so being safe with fasting is very, very important. You know, I would not recommend 24-hour fasting if you've never done it before. Always talk to someone to do that. And so because of the electrolyte abnormality and stuff like that. So if you want longevity, you want the best bang for your buck from an insulin resistance perspective, it's about 24 hours. I would say the minimum is about 16 hours of fasting. So that 8, 16, whatever you want, a ratio you want to call it, you know, that probably gives you start to get the bigger bang for your buck with respect to fasting as well. Yeah.
That's where we're getting more cellular cleanup as well,
Yeah,
right?
yeah.
Is it after that 16-hour process, you know,
Yeah.
weight management can kind of come in
Yeah.
slightly before, but
Yeah.
that 16 hours seems to be just that prime place for all
Yeah.
these changes within the body,
Yeah.
whether it's
Because it's
hormonal,
far enough where
metabolic.
you're producing some actually energy from your fatty acids and stuff like that breakdown, and so you get a bit of ketone, so it's actually easier. So the longer you fast, actually the easier it is. And there are hormonal changes from your ghrelin hormone, hunger hormone, and leptin hormone too as well. And by the way, when you fast, your stomach doesn't shrink. People think your stomach shrinks and stuff like that. It's empty and it's a sack, but it doesn't shrink any further from what it is. It's the hormones that change that makes us feel we want to eat or not eat, the hunger hormones, the ghrelin hormones. And you think about hunger hormones and leptin hormones, they don't just go up and just stay up steady. They fluctuate, like this. And so if you ever had a hunger hormone, you felt hungry and you were too busy and you were doing something and it disappears after like 20-30 minutes, that's normal. That's because it's a sinusoidal, it depends on the peaks and valleys. That's all it is, right? And so leptin hormone's the same. So over time, what happens is you get used to it. The hunger hormone starts to adapt to what you're doing, right? So, okay, my hunger signals is going high, but he's not eating. Well, what's the point? So it just kind of start to adapt to your new lifestyle too as well. And so the more you fast, these hunger hormones starts to adapt to as well and allows you to fast easier.
Right. So it's not a constant state of hunger hormone. It ebbs and flows as we go through.
Exactly.
That's wonderful. All right.
Now, breaking fast, we didn't talk about it. I got a few minutes here, and I just want to touch base breaking fast, And I like that slide that Sam just pointed out, with the big spike in insulin and stuff like that. If you're doing this for health, you don't want to chow down, like 1,000 calories, 1,200 calories in one sitting after breaking fast. And particularly those that fast for a long period of time, like 8, 12, 14 hours, fasting is voluntary. When you start to feel hungry, it becomes uncomfortable, start to eat. The longer you go and the more you feel that, the more you're going to eat, and the faster you eat, and the faster you eat, the more calorie consumed, the more calorie consumed, the higher insulin spike. So you want to control that. That mindful eating that Sam talks about, you should have 20 minutes about eating. You should slow you start to introduce foods, the complex carbohydrates, the good fats from nuts is a good way to introduce it. Having maybe some more protein will give you the satiety part, and mitigate some of the insulin spike. And so, the same concept still holds with respect to eating a regular meal and the amount of food you're eating, because you're going to reduce the benefit. All that hard work, is going to somewhat dissipate if you eat a very large meal or a refined carbohydrate meal, right? And that's why sometimes people who fast don't get the benefits. They eat a very large meal or they very fast and they're still munching in the middle of the night. That happens a lot, right? So because there's a 20-minute delay from the time you feel, you're satisfied to you're full, right? So you eat actually quite a lot more. Then you have about 20% increase in terms of calories. So that's why we want you to eat about 20 minutes for the meal too as well, right? So
and I want to chuck that as a challenge to those that are on here tonight and are watching that. I actually challenge you to take 20 minutes to eat your meal. And you may think you're close, or you may think, all right, I do eat quicker, I eat longer, but actually put it on clock. Put a little timer there, because you'll be quite surprised of what you think is actually happening to what is happening. And 20 minutes can kind of take some time. You'll have to find some strategies, knife and forks down in between bites, because we all know that most of us are sitting there with the next bite ready to go as we're chewing, busy lifestyles, those type of things as it goes. But I challenge you, and I know who you are that are on here tonight. I'm going to see how you're checking in there as we move on through. Now, when I hear that, we're just kind of running in our last minute, but the more I fast and practice that, being able to change time versus, I've got a comfortable intake with my nutrition. I find with all the benefits come from fasting, it's like the number one thing for myself in this moment, like thinking about the cell regeneration, that growth hormone that I can actually turn on. Unfortunately, it is decreased for myself over this time. I'm not 30 anymore. But yes, exercise and fasting can help with that as you go on through. But there's so many benefits.
Just because you mentioned exercise, don't exercise when you fast. Okay, if you're not used to fast, especially doing prolonged fasting. I mean, you get an exercise, obviously, 6, 8 hours exercising is okay. But even if you're doing prolonged fast, don't exercise. Some of the side effects I just want to mention quickly. Dehydration is the most common thing. Electrolyte imbalance is the next thing. That's why there's lots of like helps out there with respect to electrolyte pills and stuff like that to help that. That's why you want to know your blood work. Are you prone to like low calcium, low potassium, low magnesium, etc. The cramps might occur too as well. If you have acid problems in your stomach, you might get more dyspepsia, meaning like stomach pains. You can worsen acid. So there are side effects to fasting too as well. You know what I mean? So be very careful with fasting, especially when you do prolonged fasting. You can use aids such as bone broth to help fasting as a liquid fast. So that's almost like a ketogenic style because you're consuming good oils and fats and stuff like that.
And
So
you're getting good
those are some of
nutrition
the
in
benefits.
too.
Yeah, nutrition. Yeah.
Yeah.
So those are the keys. Fasting is a huge topic, but if you can master fasting for whatever reason, it carries its weight a lot.
Thank you. And we've hit that time. So thank you for joining us. We can definitely talk more. There is, we've got what have I got out there? A blog that's on our website as well. You can read about a little bit more fasting, or you can, message us and ask us a few questions. But next month, we're quite excited about this. Dr. Lee's very excited. We're going to kind of start working on talking about the cognitive formats again, instead of just talking about the macros and looking at fasting, but doing why the checkup from the neck up is important in weight loss, not just eat less, move more, but where that cognitive element comes along. So I really look forward to that as we get going. I hope to see you next month on that webinar, but have a great night, folks. Try and test out to see, just an hour extra tomorrow if you haven't fasted tomorrow to see what it's like. But we'll see you then. Thanks a lot, guys. We'll see you soon.